I think sometimes people equate testing with feeling better. And a lot of times what they really need is they want to know what's wrong with them and they want to know what they can do about it. That doesn't always require testing, and it doesn't always require prescription medications or fancy treatments.
For people with symptoms of heart disease or at high risk for it, this test can be life-saving.
No complaints yet.
It stresses the heart to measure the chances of having a heart attack, but a stress test is less accurate for low-risk people and can be misleading.
It can often show abnormalities in people who have nothing wrong with their heart. And that leads us to further testing and often to invasive testing, such as cardiac catheterization and angiography.
And overused or unnecessary procedures don't stop there. The American Board of Internal Medicine Foundation asked more than 24 specialty groups to each list 5 common tests or treatments that are frequently overused. It's part of the Choosing Wisely campaign to reduce waste and prevent harm in healthcare. The lists include CT scans or MRIs for uncomplicated headaches. Radiologists say they rarely help diagnose the cause. Also overused, bone density scans. Family physicians say most people don't need one until they're at least 65. Even colonoscopies made the list.
So the bottom line of colonoscopy is it's a very important test for people to get screened for colon cancer, but more isn't better. Doing more than what we recommend subjects people to potential harms that can be really severe without really getting them more benefit in terms of colon cancer.
Some of the tests and procedures that doctors identified are so common that patients expect them.
Well, actually, I really kind of wanted a stress test.
In this simulated office visit, the doctor is modeling how to just say no to a healthy patient.
You really have a very low likelihood of having heart disease. So doing tests like stress tests really don't give us much, and it also creates a potential for harm.
Dr. Amir Kasim was a lead author of the Choosing Wisely guidelines for the American College of Physicians.
We're spending almost $200 or so billion every year on these unnecessary tests and procedures that are actually not having any impact on the patient outcomes.
He hopes the focus on overuse will lead to better conversations between doctors and patients.
Ask questions from your doctor. Ask them, what is the benefit I'm going to get out of this test once you get the results? What are the harms of these tests? And what may be the cost of the test even for the patient?
You may find that a simpler, safer option is available. Learn more at consumerhealthchoices.org.